All right, hi, this is Madeline. I'm doing my essential line video. Here is my table I'm working with, all my supplies. I don't have anything else. It's just my kit and gloves. And then all I have here is the MAR, the orders. There is nothing on it, just so you can see that. Okay, oops, I'm sorry, just getting set up here. Okay, so we're just gonna start off by reviewing the MAR. So looking at my MAR here, in the private provider's orders, we have Shirley Cost. Her date of birth is 5/14/88. Looks like she has an allergy to codeine. So I already did her assessment a little bit ago. I'm looking over her labs. Everything looks all right. Nothing too pertinent. So looks like we are going to give a heparin IV flush, 5 mils. Have that here. Her antibiotic ceftriaxone is due, 1 gram IV push. I'll be drawing some blood from the central line so we can get her labs updated. And then it also looks like I'll be changing her central line dressing. So while that looks good, I have all my supplies right here. Right away, I'm just gonna do my first med check. So I don't actually have a bottle of ceftriaxone. I just have sodium chloride. So for the sake of this video, we're gonna pretend that this vial is 1 gram of ceftriaxone. Normally I would reconstitute it according to what the bottle says, what policy is, according to the solution that it wants you to reconstitute with, but for the purpose of the video, I don't have that, so we're just gonna pretend. So doing my first med check, I have 1 gram ceftriaxone here. It's not expired or anything. I don't see any holes. Again, I would reconstitute it, looking at the directions for this, looking at how fast I push this. So that's my first check. Just gonna make sure I have all my supplies. I have a bunch of alcohol wipes. I have syringes. I did forget. I just realized. I have it right here though. I had to grab my disc. On my disc, I have the central line dressing kit. I have syringes. All right, I think that's everything. So I'm gonna do my second med check. So again, we're comparing this to the MAR. We have 1 gram ceftriaxone. We're giving it IV push for Shirley Cost. That all looks good, adds up. This is not expired. Again, I would reconstitute this according to what the bottle says, but for the sake of the video, I'm just gonna pretend that I'm drawing up 1 gram. So I'm just gonna drop about 4 milliliters. I'm not sure what it would be, but for the sake of the video and not having that, it's just what I'm gonna do. So have an alcohol wipe. I'm gonna scrub the top of the vial. We're gonna let that dry. It's going in the garbage. Okay, so I have my syringe here. I have my needle. I'm gonna use to draw it up. Again, I would have reconstituted it, but it's kind of hard when we don't have it. So I'm just gonna drop 4 mils of air. Inject that. Okay, so we're gonna get the gram of ceftriaxone drawn up. The syringe doesn't want to pull back. Okay, almost there. Okay, so I have my 1 gram of ceftriaxone pulled up. So I'm just gonna carefully recap that. Okay, just gonna make sure there are no air bubbles in there. That looks good. I'm gonna label this as 1 gram of ceftriaxone. It's the only one I'm bringing in there, but there's a lot of syringes, so I just wanna keep it straight. So my second med check is done. I went over my supplies. I think I have everything. So I'm gonna go into Shirley's room. So gotta get everything repositioned over here. Knock, knock. Hi, Shirley. My name is Madeline. I'm gonna be your nurse today. Can you verify your name and date of birth with me, please? All right, just gonna check your wristband over here. I see you have an allergy of codeine, is that correct? Okay, sounds good. Shirley, I'm here because Put the hand sanitizer down there. I'm here because you have an antibiotic due. It's called Rocephin, for the infection you have. I'll be giving that to you. I have to draw some blood so we can take that to lab and get your lab ranges up to date. And then I also will be changing your central line dressing. Is that okay if I do all that today? Okay, sounds good. Do you have any questions on anything? Okay, well, let me know if you think of any. Again, I just have my MAR here. I'm just bringing that over for reference. And at this time, she's not hooked up to any continuous IV infusion, but if she was, I would pause it, disconnect it for at least a minute before I start the blood draw. And I'm just gonna bring everything from my table over. Like I said, I have quite a few syringes. And I always like to have extra. Alrighty, not my alcohol wipes. I have a box of gloves down here I'm gonna grab. So, some hand hygiene, put some gloves on. Like I said, the infusion is not running right now. So, we're gonna be working on the distal lumen of the catheter. So, I'm gonna scrub the hub for 10 to 15 seconds. And first, I'm gonna get an empty syringe, and I'm gonna attach that and unclamp it. And we're gonna withdraw about 5 milliliters of blood. Gonna move nice and slow. Okay, so I have the 5 mils of blood. Detach this. I'm gonna dispose of this in the appropriate bin right away, so that's disposed of. Scrub for another 10 to 15 seconds. Every time I do this, I'm making sure that it is completely dry. So now I'm going to attach another 10 ml syringe, and per the orders, we are going to withdraw 8 mils of blood. So I'm going to slowly draw up 8 mils of blood so that we can get that sent to the lab. Okay. So I have my blood. I'm going to put this in the appropriate lab tube right away. So I'm going to set that to the side for now. Scrub the hub 10 to 15 seconds again. Allow that to dry. I have a flush of 10 mils of normal saline that I'm going to attach. I'm just going to flush this. We're going to look for patency, and we're going to make sure that everything looks good. Are you doing okay, Shirley? All right, good. So the patency is good. I'm not feeling any resistance. I don't want to go too fast here. Okay, so that's good. I'm going to make sure I clamp this. And I'm going to remove this, dispose of this. All right, Shirley. So I have my blood here. I already put it in the appropriate lab tube. I'm gonna make sure that I label it with my initials, the date and time that I collected this. This is gonna get sent to lab right away. So this is sent to lab. So now I'm gonna do my third med check. So again, I have my 1 gram of ceftriaxone that I drew up here, comparing it to the MAR. This is 1 gram. I reconstituted it according to policy and what the bottle says, with the appropriate amount and the appropriate diluent. It's not expired. Everything looks good with this. I do have 4 mils for Shirley Cost. So, sorry, my nose is running. Okay. All right. So, make sure I'm not forgetting anything. So I'm gonna go to this, scrub the hub, 10 to 15 seconds, allowing that to dry. I'm gonna grab a 10 ml syringe of normal saline. I'm gonna unclamp this, and I'm going to aspirate a little bit for a drawback of blood, which I see that, so that's good. I'm gonna go ahead and push the 10 mils of normal saline. We're going to use the pulsatile flush method. So I'm going to push about 2 mils of fluid, and then I'm going to pause. And I'm going to push 2 more mils of fluid. And then I'm going to pause. I'm going to keep doing that all the way for the whole syringe. So pushing 2 more mils, pausing. And this is so we don't get an occlusion or clog or anything. Pushing 2 mils, 1 more pause, and then I'm pushing the remaining 1 mil. Okay, I'm gonna clamp that. I'm making sure that I'm holding positive pressure on the plunger, removing that. I'm gonna scrub the hub, 10 to 15 seconds. I'm gonna make sure that this dries completely. That looks good. So now I have my Rocephin. This is gonna go in the sharps container right away. I'm gonna attach this, keep positive pressure on the plunger, unclamp it, and I am going to administer this at the appropriate rate, which I already looked up. So I'm gonna push 2 mils slowly. And we're also using the pulsatile flush method with this, so I'm gonna pause. Patency looks good. I'm gonna give the remaining 2 mils. Okay, that looks good. I'm gonna clamp that. We got the ceftriaxone administered. So clamping that, keeping positive pressure on the plunger while I take it off. Okay. So now we're gonna flush again with 10 mils of normal saline. Scrubbing the hub first. So I have another syringe of 10 mils normal saline. Put that on. Unclamp. Once again, we're using the pulsating flush method, so I'm going to push 2 mils. Pause. 2 more mils. Pause. This probably would be different in real life, but just for the sake of the video and for time. Pausing. 2 more mils. Pausing. Pushing my last 2 mils. Okay, so I'm holding the plunger down with positive pressure, clamping, and I'm removing. Lastly, we just need to do the heparin. And I would always do the heparin according to the facility policy. Scrubbing the hub 10 to 15 seconds, allowing that to dry, not contaminating anything. Okay, so we're gonna attach the heparin. And per the MAR, like I said, we are giving 5 mils. I'm gonna unclamp it. And once again, we're using the pulsating flush method, so I'm going to push 2 mils. And then we're gonna pause. I'm still not feeling any resistance, so that's good. Okay, I'm gonna push 2 more mils. I'm gonna pause. I'm gonna push the remaining 1 milliliter. Okay, so now I'm going to clamp this. I'm gonna use positive pressure. Take that off. All right, Shirley, we're almost done, okay? So I'm gonna scrub the hub just to be safe. Can't be too safe. All right, so we're all done with the medications and the blood draw. So now it's time for the, to change your dressing. Is that okay? Alrighty, so I'm just gonna kind of get everything straight here. I'm gonna move the MAR over here. Are you in a comfortable position, Shirley? Okay, good. So I'm gonna have you turn your head the other way while I change your dressing, and I'm gonna give you this mask to put on, okay? So here you go. I'll have you put this on, and I'm gonna have you turn the other way. And I'm just gonna grab my supplies here. So with my central line dressing, I have the foam disc, I have an extra pair of sterile gloves. I think that is all I need for now. So I'm gonna go ahead and open my sterile kit right away. Maybe. I'm making sure that I do not contaminate it. Okay, so I'm just gonna take my mask. I'm gonna put my mask on, not touching anything else yet because I'm not sterile. Put my mask on and I'm gonna assess the site right away. Shirley, let me know if you have any pain or tenderness. I have a new pair of clean gloves on. Okay, I don't see any redness, swelling, discharge, drainage. That looks good. Yeah, so that looks good. I'm gonna go ahead and remove this. Maybe this doesn't want to come off my finger. Oh my goodness, okay. I'm just gonna try and move this closer so you can see everything I'm doing. All right. Okay, so I'm just gonna get rid of this guy. So I still have clean gloves on, so we're gonna go ahead and remove the old dressing. The dressing is intact, so that is good. I'm gonna make sure I'm securing the catheter, and I'm gonna remove it from the outside. We're gonna work our way in. This is very sticky, so it's kind of sticking to my gloves. Oops. Again, I'm making sure I'm stabilizing the catheter, looking at the length, making sure it's not getting pulled out at all. Oh my goodness, I'm getting really stuck. Okay. The gloves are falling off because they're sticking. Okay, securing the catheter. Alrighty, just being careful. Okay, so that is secure. Again, I'm being really careful not to tug it out or anything. So after I move that, I'm just taking a look at the catheter, taking a look at the hub. That looks good. After removing the dressing, I still don't see any signs of infection. I don't see any drainage. Just gonna put some hand sanitizer on. Okay. I'm not going to touch my sterile kit. I'm just moving it over here a little bit so I can put my sterile gloves on. Before I do that, I'm going to open up my disc and I'm going to put that in here. So that is sterile. Okay, that's good. I'll open up my sterile gloves. I brought an extra pair because I have big hands. So I'm going to open this. Be careful not to contaminate them. I'm only touching the outer 1-inch border. Okay, so I'm gonna see if I can get these on. Oh, so make sure you can see that. Well, my pinky doesn't want to go in, but there we go. Making sure that I am not contaminating it, not touching anything. So I'm gonna grab the other one. Touching the cuff. Okay, that went a lot smoother than my first try. So I'm gonna take this, just touching the sterile area. It's going in the garbage. Move my sterile kit over. So let's see what we have. So I'm gonna grab my ChloraPrep, and I'm gonna scrub on the I'm gonna scrub the inside back and forth, working my way out. So I'm gonna grab this, hold this up so hope you can see this okay. So I'm scrubbing around this, using some friction so we get it nice and clean. I'm holding the sterile gauze with this so I don't contaminate it. We're going back and forth, back and forth. I'm going to make sure I get a clean an area larger than where the dressing is going to go, just so we have everything super clean. Okay, so that's good. Okay, this goes in the garbage. So don't need those. I have the foam disc I'm going to put on. I'm going to put the foam side down. Okay, so that looks good. Now I have my dressing I'm going to put on. Okay, so that is secure now. All right, Shirley, we are almost all done. Are you feeling okay? Oh, good. I'm glad. So I'm gonna peel this off. Making sure that I'm sticking it all the way down, that it is nice and secure. Okay, you can see that okay. My dressing is on there. I'm going to take this label, the sticker, and I'm going to put it on here so we can label it. I'm going to put my initials and the date that I changed this and the gauge and length of the catheter. So, all right, Shirley, you can take your mask off now. I'm all done. I'm just going to clean up. So I'm going to clean up all my supplies. I'm going to make sure that Shirley is in a safe position. If you want to see this, okay. I'm going to make sure Shirley is in a safe position. I'm going to come check on her in a bit, but she has her call age until then. I'm going to document that I performed the dressing change, that I didn't see any redness, swelling, drainage, no signs of infection. The previous dressing was intact. I'm going to document the gauge of the catheter and the length, that it didn't get pulled out or anything. Document the type of dressing I put on, the date and time that I did it. What else would I document? Obviously the meds, the blood draw is sent to lab. So yep, I'm going to clean up, do my documentation, and I think that covers all of it.